It is now time to learn all the bones of the skeletal system. There's a total of 206 bones that make up a typical adult skeleton, and it is customary to divide that into two systems, or two skeletal systems. The axial skeleton, which this PowerPoint will cover, and the appendicular skeleton. This table shows the distribution of bones in each of these divisions of the skeletal system. As you can see here, the axial skeleton consists of bones that lie along the vertical axis of the body. They include all the bones that form the skull, which it consists of 8 cranial bones and 14 facial bones. There's a bone called the hyoid bone, which lies just beneath your tongue, and it is situated in the cervical area, or in the neck. There are 6 auditory ossicles, which are very small bones found in the inner ear. There are 26 total bones that form the vertebral column, or your backbone. There's 1 sternum and 24 ribs. So the axial skeleton consists of a total of 80 bones. The appendicular skeleton, which consists of bones of the upper and lower limbs, consists of 126 bones. So when we get to that division, we will begin with the pectoral or shoulder girdle, which consists of a clavicle and scapula. We will move down or distal through the upper limb and learn the humerus, radius and ulna, carpals, metacarpals, and phalanges. Then we will move in and learn the hip or pelvic girdle, which consists of 2 hip bones, also known as pelvic bones or coxal bones. And then finally, in the lower limb, we move distal from femur, patella or kneecap, fibula, tibia, tarsals, metatarsals, and finally the phalanges of your toes. So that equals a total of 206 bones. We will actually save the auditory ossicles until we get to hearing at the end of the semester. So before we begin, there are some new words that are used to describe what we call bone markings or surface markings. What a surface marking or bone marking is it's a structure on that bone, typically, or I should say always there for a reason. So some of these structures or bone markings are depressions or openings or holes in the bone. Typically those are for soft tissues to travel through or along a bone, like nerves, blood vessels, ligaments, and tendons. So for example, a fissure is defined by a narrow slit in a bone or in between bones. Often that narrow slit allows blood vessels or nerves to pass through that bone or in between the bones. A foramen is a hole in a bone, and typically that hole or opening is for blood vessels, nerves, or ligaments to pass through. A fossa is a shallow depression in a bone. A sulcus is a groove or furrow in a bone. And then finally, a meatus is a tube-like opening in a bone. There are some examples listed on this table. We will actually be learning all of these surface markings in this table, so we will address them when we get to those bones and their markings. There are also processes found on bones. These are projections or outgrowths on the bone. Usually these are there to either form a joint with another bone, or they serve as an attachment point for ligaments and tendons. Condyles are the largest processes found on bones. The word condyle actually means knuckle, and in fact, the knuckles in your fingers are formed by condyles coming together. But by definition, a condyle is a large, round protuberance with a smooth articular surface. So articular surface means it forms a joint with another bone. A facet or facet is typically much smaller than a condyle. It's a smooth, flat, or possibly slightly curved surface. And those are also typically for a joint formation. Head is usually a rounded projection. Then there are processes that form attachment points for connective tissues, like crests, epicondyles, trochanters. We're going to learn some trochanters that are found on the femur. Tubercles are knob-like structures, and tuberosities are usually rough or bumpy surfaces. So these are new words that we will be using quite a bit when we learn about these bone markings or structures that are found on particular bones. So that was a little bit of an introduction to some terminology and the axial versus the appendicular skeleton. The next video, we're going to begin learning bones of the axial skeleton by starting with the skull.